Hi everyone, and welcome to the High Impact Medicine podcast. In each episode of this podcast, we talk to a medical professional who is pursuing what they consider to be particularly impactful work, either alongside or learning from clinical practice. We'll discuss their journey from med school, the impact of their work, and any advice they have for someone interested in going into the same area. So Lucia Coulter is a doctor turned charity founder. After completing med school in Cambridge, she worked as a junior doctor. Over a year ago, she co-founded the Lead Exposure Elimination Project, LEEP, a non-profit working to reduce lead exposure via lead-based paint. And she currently serves as the co-director of LEEP. Lucia, thank you so much for joining us today.
Yeah, thanks, Abe.
No worries. Lovely to have you here with us. So to start, I was wondering if you could tell us a bit about your journey from medical school and what you do now.
So I graduated medical school in 2018, and I worked for a couple years as a junior doctor in London. I completed like F1, F2, for those who are familiar with the structure in the UK. Well, I kind of decided a while back that I wanted to do something in public health or global health or something kind of with a potential for a larger scale impact. And I thought after F2 might be a good time to try that out. So I applied for the Charity Entrepreneurship Incubation Program, which is an incubator that helps people start high impact charities. And through that, I co-founded LEEP, which is what you just described. We're a health policy nonprofit, and we're trying to reduce childhood lead poisoning in low and middle income countries.
So what was charity entrepreneurship like? Where did you hear about them? What was their program like?
Yeah, so I heard about them through the effective altruism community, which I've been involved with for many years, and also through a couple of friends who went through their program and started high impact charities. And basically what they do is they research promising charity ideas, and then they help you choose which one of these ideas to start. They help you find a co-founder, and they teach you like all the things you need to know to get started. So everything from decision making, cost effectiveness analysis, monitoring and evaluation, planning, hiring, budgeting, fundraising, all of that kind of stuff. And then they give you mentorship and guidance. We had for a whole year like meetings once a week with advisors. They connect you with a community of other people doing the same thing, and they also can give you seed grants. So they gave us a seed grant to get started, which was super helpful. If anyone thinks that sounds cool, their applications are open at the moment, so you could check it out on their website.
Originally got you interested in doing good or doing this sort of work?
So I think everyone is interested in doing good. I think what got me kind of taking it more seriously was basically just kind of thinking about how much I really do care about it. Like I care a huge amount about like health and happiness of the people who are close to me, and it never seemed right that I'd be willing to kind of do or sacrifice so much for those that are close to me, but would do very little or let those further away in countries further away suffer or die for perfectly preventable reasons. And yeah, so I used to think about that quite a lot. And then when I was younger, I read an essay by Peter Singer called Famine, Affluence and Morality, which kind of confirmed my motivation. You're probably familiar with the essay, but basically he makes some kind of thought experiments and moral arguments and concludes that if it's in our power to prevent something bad from happening without sacrificing something of equal moral significance, then we ought to do it. And it makes no difference whether that person is 10 yards away or whether there's someone whose name we'll never know 1,000 miles away. So yeah, I think when I read that, it just made sense to me, and it kind of confirmed this idea that I should be doing a lot more to have a positive impact on the world. And so I thought a lot about how I might do that. And when I was at university, I got involved in effective altruism. And that's a kind of social, philosophical movement, which is all about trying to answer the question of how can we use our resources to improve the lives of others the most, and then trying to act on that answer. And that kind of, helped me think about that a bit more, and then led me to the...
Brilliant. Yeah, I think it's something that most medics have in their mind, like helping people they see every day, but then also that the people you see who are equally suffering around the world, just because we don't see them doesn't mean their lives have any less moral weight, I guess. So just talking a bit more about that, is that why you're interested in global health in particular over another cause area, say about animal suffering or biosecurity or something like that?
Yeah, I think broadly I'm pretty kind of cause neutral. Like I care about reducing suffering and increasing well-being, and so I'm open to contributing to a wide variety of causes. Like you say, health, mental health, reducing poverty, improving the lives of animals, improving biosecurity, reducing global catastrophic risks, all of that good stuff. I think the reason I have ended up in a health policy, health-related role is partly because of the medical background, which I think provides some comparative advantage, and also partly because of the specific intervention that I learnt about, which is around reducing lead poisoning. And it's just seemed like something that was a very important, huge scale problem. 1 in 3 kids have lead poisoning. Also massively neglected. There's only around $7 million a year going towards reducing lead poisoning in low and middle income countries from nonprofits, which is ridiculously small considering that it costs the economies of low and middle income countries almost $1 trillion per year. And it also seemed like a really tractable project. There are solutions and other countries have solved the problem. So basically cause neutral, but prioritizing things kind of according to that kind of general framework.
Nice, yeah. I think we'll come back to the comparative advantage as a doctor you mentioned in a little bit. But first, I was just a bit interested, what does your typical day look like as co-founder and co-director of LEEP?
Yeah, so a typical day when I'm in the UK and not like in one of our focus countries might be having a morning meeting with the team. So there's 3 of us on the team, Jack and Claire, and maybe one of our interns might join. And in that meeting, we'll discuss what we're working on at the moment, what our priorities are, which countries we're engaging, kind of what step we're at in our approach and what the next steps are. We might ask each other for like strategy advice, or can you check this email to this person in this government? Like, does this sound okay? You know, that sort of thing. We might talk about what other countries we're thinking of focusing on next, look at, you know, how neglected they are, what we think the lead burden from paint is likely to be, and whether they look like the governments might be open to talking to us about this policy. And so that might be like the first hour or so of the day, and then I'll kind of get on with whatever tasks we've decided to prioritize. And that might be having calls with people in our focus countries, that might be writing emails, doing a bit of background research. Sometimes there's operational stuff that needs to be done. Sometimes we are working on fundraising and applying for grants and that sort of thing. So it's really, really varied. Quite a bit of interaction with other people. And
yeah, very, very cool. And you mentioned traveling. How often do you do that, and what does that look like when you're abroad?
Yeah, so it's been a bit irregular because of travel restrictions and the pandemic, etc. But last year I spent 3 months or so in Malawi, where we have been working, and I spent a couple of weeks in Pakistan, where we were also doing some work. So in Malawi, basically what that involved was meeting kind of health policy experts, meeting people in the Ministry of Health and in the Bureau of Standards. And one of the main things that we do when we go to a country is we go to all of the paint shops and paint markets, and we buy all of the paints, and then we dry them and lay them out in either a lab if it's available, or just kind of in our Airbnb, lay them out to dry, and then we send them for analysis for the lead content. And then once we have that data, we bring that to the regulatory authorities and ministries of health, ministries of environment, environmental protection agencies, and we explain, look, there's a load of lead in your paint. And before, this is generally not known because there's no data around this. And we explain that it's really solvable. You just need to regulate it. You need to enforce the regulation, and we can help you do that. And then we might go around and talk to the paint manufacturers themselves. So in Malawi, for example, there are around 4 or 5 local paint manufacturers. So we might talk to them about what they're putting in their paint and what they think about the use of lead, and whether they're down to remove lead from their paint and how we can help them do that. Like, what are the barriers? Is it that you're struggling to find the alternative ingredients? Is it the cost? Is it the technical expertise? And then we figure out how we can help.
So cool. A bit of everything from lab work that you might do as a medical student, like campaigning for reform and talking to huge stakeholders. Very valuable, yeah. And so for all of that, what sort of skills and experiences have you sort of learned or needed compared to when you were an F2 doctor, and how have you sort of developed those?
Yeah, so I think a lot of the skills are pretty cross-applicable from being an F2 doctor. So I think, I don't know, when you're a junior doctor, a lot of what you do is decision-making under uncertainty, right? So you're often just faced with decisions, patients, diseases, and you never have quite the complete picture, but you need to figure out what to do. And that's basically the same thing. So those kind of judgment and decision-making skills are pretty important, I think. I don't know if this is a skill, I think it's a skill that is actually the same as being a junior doctor, is like how to ask for help and how to speak to experts. A lot of what you do as a junior doctor is you think, okay, who's going to know what to do here and how can I ask them and get them to help me? And it's the same thing when you're starting a new organization or doing this sort of work. You're never going to know the vast majority of things. And so a lot of it is figuring out how to get the help and advice and support that you need. And then, like you were saying, there's a lot of like talking to stakeholders. So the communication skills, especially in like kind of difficult or kind of high pressure situations, which is something that you also have to do as a doctor and in this role. And then I guess the other skills are like research and scientific literacy, a bit of statistics, because we're we want to be very evidence-based, we want to evaluate our impact. And so those are things that you learn at medical.
And I'm guessing charity entrepreneurship taught you a lot as well.
Yes, exactly. So charity entrepreneurship teaches you like everything you need to know to get started, basically. Yeah, making our first plan, how to do like country prioritization, how to do monitoring and evaluation.
Amazing, yeah. So going back to what you mentioned earlier, what do you think sort of the comparative advantages in someone in your position as ex-F or someone who previously did F2 compared to, I don't know, someone who's done an independent sort of maybe science or even humanities degree moving into CE and global health?
Yeah, so I think some of those skills that I mentioned are quite specific to like working as a doctor, like the kind of decision making and judgment and communication. Having the science background is really helpful. But I think a major thing that comes with being a doctor is you do have an added level of credibility. And when you're advocating about a health policy to a health ministry or to any kind of other stakeholder, it just gives you a bit more credibility, especially because a lot of the time we're working with partners who are other doctors, or there may be doctors in the kind of government departments that we're working with as well. And so it's just quite helpful.
Yeah, that makes a lot of sense to me. So moving on a little bit to sort of the balance with clinical medicine. So I was just wondering, do you currently practice clinical medicine at all?
So not a lot. I'm on a couple of like locum banks, and I do a very, very occasional locum shift, but I've only done a handful over the last year or so. And I'm not sure how I'm going to balance that going forward. There are things I miss about doing more clinical practice. It is quite fun working in the hospital, and it's quite fun interacting with patients. But I do find overall the work I'm doing now a lot more rewarding, a lot more fulfilling, just because of the scale of impact that we can have.
Right. Well, I guess
currently I'm feeling a lot more motivated to focus on this.
Yeah, I guess you've kind of answered my next question, which was going to be, how was your experience taking a step back? So, and you've mentioned how it's difficult in parts, but you're finding this more rewarding.
Yeah, exactly. Initially, it was very scary to like do something that my like kind of F2 friends weren't doing. Like most people weren't going straight into specialty training, but almost everyone was doing something quite clinical. So it was quite scary doing something different. And it was really, really, really helpful to have examples of other people doing similar things, starting high impact nonprofits, and kind of taking breaks from clinical medicine for extended periods of time, or doing very, very little alongside other projects. So it was really nice to see that can be done, because it's a scary thing. I think from when you start medical school, it just seems like such an obvious and clear path all the way to like becoming a consultant. So it was tricky, but I'm glad I did it.
So what are your plans for the next few years? Where do you see your work with LEEP going, and do you plan to do any more clinical medicine?
Yeah, so next few years we want to scale. We think our approach is impactful and very cost effective. And so we'd like to work in more and more countries and reduce childhood lead poisoning larger and larger scale. We also want to look at other sources. So right now we've been mainly focusing on paint, but we're keen to look at whether there are other important sources of exposure that are also tractable to address in a similar way to the way we're addressing lead in paint. And in terms of clinical, I really don't know yet. I'm not thinking right now about like increasing the amount of clinical I'm doing. But yeah, it could be that at some point it seems like it would be really advantageous to have like to be doing that alongside.
That makes a lot of sense. So talking about sort of founding impactful nonprofits more widely, especially in global health, who do you think is sort of a good fit for that sort of career path?
Yeah. So I think it has to be someone who like wants to have a positive impact, like at scale. I think if you're satisfied with kind of seeing one patient at a time and having kind of person by person kind of positive interactions and impact, and aren't particularly driven to have like a larger scale impact, then it might not be so kind of motivating. So I think kind of, having that kind of ambition is helpful. I think it's also quite important, similarly to being a doctor, to be quite resilient. Like being a junior doctor is just a very intense job. It's very high stakes, and it's also quite risky. Like there's a pretty high chance that whatever idea you found won't actually work. And so you need to be resilient enough to kind of keep it up despite that. I think also being quite like self-motivated and proactive, because ultimately it's all just like on you and your co-founder, if you have one. And it's not like someone is telling you what to do or checking in on you. You need to be able to motivate yourself to just kind of make things happen without any accountability. What else? I suppose particularly in nonprofit entrepreneurship and in the like health realm, you need to be very willing to like admit mistakes and be open to realizing that what you're doing is not working, because there's a risk of doing harm, of course, if you're going to be getting involved in anything to do with health. And so you need to be like very open to like critically analyzing and evaluating what you're doing and then stopping or changing path if it's not working.
I think that gives a sort of a good sense of the sort of person who might be a good fit. And so what advice would you give a medical student or a doctor interested in doing something like that? Are there any sort of any cheap tests, any ways to get a bit of experience to see if it might be a good fit?
Yeah, for sure. So I think to test whether or not you like to do kind of self-motivated projects, I think it can be quite helpful to just like try a self-initiated project, like something like, I don't know, starting or running a small kind of student or junior doctor group, or maybe a research project or a volunteer project, or even like a quality improvement project, if you can think of a good one. Yeah, those sorts of like self-initiated projects. See if you like a small scale like non-profit startup, basically, something quite self-contained, just to see if you like it. Also, like volunteering or interning at an early stage nonprofit, seeing whether it's an environment that you think that you'd enjoy and do well in. You could also, there's a couple websites. So the Charity Entrepreneurship Incubation Program, Charity Entrepreneurship has a website where they talk about how to know if you might be a good fit and that sort of thing. And then there's also a website that I think is really good called Probably Good. It's a careers advice website, and they have a profile on nonprofit entrepreneurship, and they talk about like who's a good fit, what's it like, and I think they might even have a section on like how to test your fit. So I would check that out as well if it's something that might appeal. And another thing, if like you kind of think it's something you want to do, but you're not confident that you're a good fit, and I think most people aren't confident that they're a good fit. I definitely wasn't. It's just to apply to the Charity Entrepreneurship Incubation Program and let that process kind of help you figure it out, and let them figure it out as well. Like they might know better kind of what makes a lot of people are very underconfident, right?
So if I was interested in global health and working in that field, but maybe not founding a charity per se, what other sort of things could someone with a health background do impactfully in the area that's sort of global health and helping people in the sort of less economically developed countries?
Yeah, I think anything where your impact can be larger. So, for example, something like research into areas that are traditionally very neglected, but are that like problems that affect a lot of people. Public health, you have a larger potential to impact a large number of people. Other kind of global health projects, other areas in like policy and advocacy. There's also definitely room for doctors working in fields like biorisk and biosecurity, earning to give as well. So a huge amount of impact can be had by contributing to other projects that are doing really good stuff. And as doctors, you often have a very stable income. So a lot of people like to donate.
And you mentioned a couple of things before, but if someone who's been listening to this wants one thing to go away and read or learn more about, what would your recommendation be?
So I'd say if you're interested in nonprofit entrepreneurship, check out the Charity Entrepreneurship website, check out the profile on Probably Good. And I'd say if you're interested in the field of lead exposure and lead exposure reduction, there are some cool kind of overview resources to kind of give you a better sense of what that field looks like. One of them is a report by UNICEF called The Toxic Truth, And Rethink Priorities has also written a report called Global Lead Exposure Report. And that kind of gives a nice summary of what's going on there and explains like the gaps that we have at the moment that people can work in. Yeah. And if someone just wants a shorter read to learn a bit more about the lead exposure problem, Vox last week just put out an article called Nearly Half of the World's Kids Are Exposed to Dangerous Levels of Lead.
So thank you so much, Lucia, for joining us and for answering all the questions. It's been a pleasure having you.
Yeah, thanks so much.